Well, good afternoon. This is an absolute delight to be here, and thank you to Women's College Hospital and Women's Exchange for inviting me to talk a little bit about this funded research from Women's College enabling women to advocate for their own heart health. So I'm going to talk a little bit about the initial data, trying to develop an educational forum or platform that is dedicated to how women take up knowledge and want to receive research that we've conducted through the Heart Innovation Research Program in a way that's meaningful to them so they'll remember it. I'll talk a little bit about the initial data, but I'll also talk about the actual ask of women. We had a cardiac prodromal symptom screening scale that was a hard copy tool, and they said, we want it where we live. We live on our phones, on our iPads, and we want to be proactive in our own health. So can you please design that for us? I said, sure we could. So this is going to take us on a little bit of a different journey. So women, and you'll not be surprised in the data, said we want to advocate for ourselves, we want to have meaningful conversations with healthcare providers, but we don't want to sound like an idiot. We want to have evidence-based background. So can you please be creative in the way in which to tell our journey, coming to the realization of the early warning signs of heart disease. So I said, well, how can we do that? They said, I want to see it, feel it, know it, so I'll know what to do about it. I thought, okay. So their words of wisdom drove us to do a very artistic depiction of what they are going through, coming to the realization of the often pervasive signs and symptoms that are experienced weeks, months, days prior to a cardiac event that they're not recognizing. This is raw pain. It's a watercolor. We have taken the verbatim words of women, distilled them into various different themes in an embodied way, and it is my privilege and honor to share those words with you today. And I'll get to the innovative app in a second. It's called Raw Pain. Rising around you like a wave of cold heat, surprisingly unpredictable, unexpected. Gripping talons of pain, ripping in flesh, searing deep pain from inside out. I can't breathe. Am I dying? I'm dying. A sadistic volcano turned inward, erupting like acid, digging at you, gnawing away, stripping me raw, penetrating, incapacitating pain, exposed raw, vulnerable. This unrelenting pain, it's pain. It's not going away. It's not getting any better. This is how women will remember to help them discover and dispel the differences and similarities of the cardiac prodromal symptoms between women and men. This was funded by Women's Exchange, and we are so very grateful. We were able to partner with community partners, industry partners, community partners, academic, clinical partners, to be able to get the information out there that is so critical into the hearts, hands, and minds of those who can really use it. Because we know that women are not recognizing those warning signs of cardiac disease, that they don't recognize them because they are couched within all other different comorbidities, all in the very fast business of their life, in amongst the various different competing roles. And sometimes the signs and symptoms are very different as compared to men. This lack of knowledge, as we know, we see it in clinical practice, we see it daily, that it increases cardiac morbidity and mortality because they don't seek medical attention sooner. So we wanted to have targeted education of a repository of research conducted on cardiac prodromal symptoms and provide this critical education to women with heart disease, to the general public and to clinicians as well, but also do it in a way that's meaningful to them. How do they want to take up this actual knowledge? Where do they receive it? How do they want to receive it? And so we wanted to devise, based on listening to them, to provide educational materials in mediums that would speak to them where they lived. So we did target women with heart disease, clinicians, and general public in the Niagara area. This aligned very nicely with women's exchange goals in terms of building research capacity in women's heart health, reaching out to community partners to potentiate that research, and then having increased knowledge uptake for women. Our research plan was very iterative to get this educational innovation off the ground. We partnered with Pivot Design here in Toronto, who is an end-user health marketing company, and we went through a discovery phase talking to women about their preferences. Then we designed what they wanted, and we wanted to deliver it in meaningful ways to them for maximum uptake and sustainability. I'm going to tell you a little bit just about the needs assessment that was conducted. We talked to 31 participants, and they were very, very specific in what they wanted in terms of heart health education and certainly targeting early warning signs. They wanted targeted messages about the differences and the similarities so that they could be on their game, that they could recognize them earlier, that they could tell their loved ones, hey, you need to pay attention to that. Developed the Prodromal Symptom Screening Scale. It was very much apparent that they wanted that as a viable resource and education for them, and the ability to spearhead their own health-related conversations with their healthcare provider in an online forum. The educational video for women, they wanted to hear the voices of women who have had the disease themselves and what they went through so they could take it to their own educational groups and where they gather. They wanted us to use social media in targeted ways in terms of providing infographics that they could download and use, put on their fridge of the signs and symptoms to be aware of, to start conversations that are much needed and overdue, to discuss how to use the actual app. And also the other products that they wanted was perhaps educational slide decks, that type of thing. So we tried to do that. So this was a poster presentation at the Cardiovascular Nurses Scientific Sessions last May, where we described that we did turn knowledge dissemination a little bit on its head, listening to what women wanted, and we did, and we're able to, because of the funding, develop heart health education for clinicians and for women and the general public with talking about cardiac prodromal symptoms. We were able to take the research, put it into plain language, and do voiceover narration so they could take it to their reading groups, their sewing groups, all of the places where they wanted to have these interactive sessions for learning. Scientists and researchers and healthcare providers are very, very busy, and they wanted to have the most salient points in the research in between their 2 seconds between patients to see how it might impact their actual practice. So we provided that as well. We provided various different infographics. This one describes the actual website and all of its resources. We also listened to women. They wanted us to come where they gather. It was very interesting in one of the actual focus groups that women told us that they wanted if I could come and talk to their sewing bees. And I thought, oh, well, that's interesting. Not that I didn't realize that you can go and there are 5,000 women at a conference and you can be a plenary speaker, and it's a fabulous way to meet them where they live and where they take up knowledge. It was a direct ask for women to develop the Prodromal Symptom Screening Scale into an online forum so that they could have access to this resource annually, so they could track perhaps differences in their heart health. It can be downloaded on an iPad, desktop, and/or phone, and it is free. The Prodromal Symptom Screening Scale is now been launched as of February. It's a screening tool that has been revised to 13 items based on clinical science and clinical practice and the research to date of the warning signs of developing coronary artery disease. The symptoms individually are evaluated for their occurrence, their intensity, and their frequency. The total scale possibility is 234 points, with each item having a maximum of 18 points. And there's different levels of symptom urgency for mild, moderate, and severe. It's married with what we already know in the risk factors, individual, modifiable, and non-modifiable risk factors, so that you can get a very good understanding of this client before you or yourself in what conversation points you'd like to bring out. So it offers recommendations based on this research to contact healthcare providers for cardiovascular risk assessment and follow-up. And it's about a 3-page, 4-page document, depending on the ranking. And it allows you to see the level of urgency. There's a green level of urgency where you just might start to think about looking at some risk factors. I've shown 2 different examples. A yellow alert is to book an appointment with your healthcare provider because this person has ranked 3 or more prodromal signs and symptoms. The red alert on the right side is to urge a person, because they have had 3 prodromal symptoms plus 2 concerning risk factors to be aware of, that perhaps you might want to see your healthcare provider sooner and start risk factor profile management as well. These are the second sheets that are in the PDF of the overarching profile, where you can see that there's the prodromal symptoms that you need to be aware of that need follow-up and have been highlighted. We've tried to make this as sex-specific as we can in terms of what we know from clinical science and the work certainly done here at Women's College about gestational diabetes and hypertension, to make it very, very specific for women to target. This is an example of the infographic of the most prevalent signs and symptoms that are experienced weeks, months, days prior to a cardiac insult, with the bigger fonts being the ones that are more occur. So this is the artistic journey through cardiac pain. We have taken the words, wise words of wisdom of women, and distill them in an artistic fashion. And we were able to present their journey through coming to the realization of early warning signs of heart disease at the Canadian Pain Society this month. And they've asked us to come to Alberta next year. So I thank you for your time. And as I say, there'll be questions later.